Hi, this is Ben Montross, and I'm the Compliance and Support Services Section Chief with the Drinking Water and Groundwater Protection Division in the Department of Environmental Conservation. I'm going to talk to you about what public drinking water systems are in Vermont. So a public drinking water system is any source or sources of water that combine to serve at least 25 people for at least 60 days out of the year. That's the minimum threshold to become a public drinking water system. There's three different types of public drinking water systems. So the community systems serve 15 connections or 25 or more people. So these are like the municipal facilities, the town systems, the city systems, fire districts, condominium associations that serve people where they live. There's the non-transient, non-community systems, which we refer to as NTNC. It's non-residential. So it's non-community, they don't live there. And it's the same people, so non-transient, so they don't come and go. So it's the same people who don't live there. And it's 25 people or more for 6 months or more. Good examples of these are the schools, business parks, factories, things like that when they have their own well. The other type is transient non-community or TNC. These are non-residential users which change over time. So there's that transient, they come and go and they don't live there. And this is if there's 25 or more people for 60 days or more out of the year. Examples for this are the highway rest stops, state parks, bed and breakfasts, campgrounds, base lodges, things like that where there's a lot of people, but they're coming and going and they don't all live there. Just for some basic overview, this is kind of how it's structured. There's 1,397 currently active public drinking water systems. 412 of those are community systems, 244 are non-transient, non-community, and 711 are transient, non-community systems. As you probably would expect, this is Vermont, so we don't have big cities, so most of our systems are very small. You can see most of the community systems are pretty much under 500 people or more. There's only six systems that serve 10,000 people or more. For the public drinking water supply program, there are three big sections. Starting from left to right, there's the operations, engineering, and capacity. These are the folks that permit new systems. They permit improvements to existing systems if they need to do construction or introduce new treatment, things like that. There's the capacity development and asset management programs. There's also the sanitary survey program, which does routine inspections of these public drinking water systems. They also draft operating permits and provide technical assistance to those in need. There's the water resources section, which identifies source permitting, source protection. They run the bottled water program and the well driller certification program. These are the folks that assess the quantity and quality of the water to make sure it's safe as a public source. There's also the compliance and support services section, which is my section. We provide monitoring oversight. We ensure compliance with federal and state regulations. We track and manage the boil water notices, do not drink notices, the operator certification program. Every public drinking water system needs to have a certified operator of the appropriate class, and the classes are based on how complicated the systems are. We oversee the TNC program. We oversee all of the data that comes in and out and the admin team. So how are town health officers often involved or linked into our process? Oftentimes you'll get copied on a boil water notice or maybe a do not drink notice if something happens at a water system that could lead to a public health risk. I'll go into a little bit more detail later about what that means exactly. But pretty much anything that could have an impact on public health. So the boil notices, the do not drink notices, if there's a lead action level exceedance, if there's a maximum contaminant level exceedance, an MCL, and then also sometimes if there's complaints from users, or sometimes the town health officers contact us if there's complaints from users. And just to be clear, that little asterisk there, so sometimes a complaint isn't a violation. You know, unfortunately, a lot of times we'll get complaints about turbid water or murky water or red water or orange or brown or purple. The likelihood is those aren't health risks or health-based standards, and unfortunately, while the water is not that great to drink, it might not be a violation, so there might not be much that follows from that. But it is helpful to know, especially if a system has treatment employed, that the treatment has failed or the treatment isn't really working, and you can get the water system operator and management involved to try to address that situation. So a boil water notice. So in order to protect public health, to prevent consuming waterborne pathogens, so these are bacteriological or viral or anything that can make people sick, there's several reasons why this would happen. One of which would be is if there's E. coli in the water. So there's an E. coli MCL established by the revised total coliform rule. And basically there's 4 different examples of how this could happen, but largely every public water system is required to take total coliform samples on some frequency, either monthly or quarterly. If a routine sample comes back positive for either total coliform or E. coli, they have to take repeats. If the repeats then are positive for either total coliform or E. coli, that could trigger an E. coli MCL. So when there's a routine that's positive for total E. coli, or total coliform rather, and the repeat is positive for E. coli, or the routine is E. coli positive and the repeat is total coliform positive, either of those iterations can be an E. coli MCL. Also, if a water system has a routine total coliform positive sample and a repeat total coliform positive sample, and for some reason the lab didn't analyze for E. coli on that repeat sample. So we know that there's an issue, but we're not quite sure how big of an issue it is. That would be an E. coli MCL. It doesn't really happen in Vermont. The labs all analyze for E. coli if there's total coliform positive, so that's not a big problem. The 4th instance would be if the water system has a routine positive total coliform sample and they do not take all of the required repeat samples. And it means all of the required, not just some. So they're required to take at least 3 repeats. If they don't take all of those, or if something happens, if one of them gets broken in the mail or it freezes or the lab drops it, we don't get a result, therefore they didn't take a sample, and that would trigger an E. coli MCL. We just don't know what's going on. We don't know how widespread it is, and we don't know that there wasn't E. coli in that sample. So another instance could be if there's an E. coli positive sample and the water system can't take the required repeat samples within 24 hours. A lot of times this happens at small systems when they don't have bottles on hand, or if it's later in the week, Thursday, Friday, they get a result, it's positive for E. coli, and they can't go out within 24 hours to take a repeat sample. If that's the case, we don't know if it was sampler error, we don't know how widespread the issue is, so we require a boil water notice be in place until we get the results of those repeats. If the repeat samples all come back absent, they can lift the boil. If one of those samples is positive, then it would likely trigger an E. coli MCL as I just described, and then we'll handle the boil that way. There also can be operational issues. This would be repairs, things like leaks, breaks, fires, water outages, things like that where the pressure can be affected or there could be a source of contamination into the system. This could be if there's mice in a storage tank also, operational issues, things like that can come up. There's also failure of treatment equipment. So if there's a chlorinator that goes down and the water system is required to provide chlorination, they're not able to provide adequate disinfection, that would require a boil water notice. And then also bulk water hauling if it doesn't conform with our existing practice, which is on our website. That can introduce bacteria and contamination into the system in one of several different ways. So if it's not done properly, then it would require a boil water notice. And bulk water hauling often happens if a well pump fails and the system needs water, or there's a big leak that the well can't keep up with and things like that. They would literally put water in a truck, drive it to the system, and fill the tank from that truck. So do not drink notices. Do not drink notices are required to protect public health by preventing the consumption of water that's potentially or actually contaminated with chemical or unknown compounds. There's a few different ways that this would be triggered at a public water system. The first is confirmation of an acute contaminant above the MCL. So there's two acute contaminants for chemicals in Vermont. That's nitrate and uranium. E. coli is also an acute contaminant, but we're talking about chemicals now. So if there's nitrate or uranium MCL exceedance, it would trigger a do not drink notice. And nitrate has that asterisk there because the nitrate do not drink only applies to infants and small children due to the risk of blue baby syndrome. Uranium, though, is applicable to all users of the water system. Manganese in excess of the health department's health advisory, which is 0.3 milligrams per liter, would also require a do not drink, but again, that only applies to infants and small children, not the entire population. As you may have seen in the news lately, there's increased focus on PFAS compounds. So we have a state standard right now of 20 nanograms per liter for 5 various PFAS chemicals. If those chemicals are found to be in excess of 20 nanograms per liter, that would require a do not drink notice also. And then things where a water system might use an unpermitted source or unpermitted materials. Only certain materials can come in contact with drinking water, otherwise they can present a health risk. So if a water system, maybe as an emergency fix, maybe just unknowingly uses some of these chemicals, that could create a health risk, so that would be a do not drink also. And then also if there's chemicals in the drinking water and we consult with the health department, with environmental health, that just shouldn't be consumed. Things like there's a gasoline spill and benzene gets into the system, or things like that we would confer with the health department and assess whether it's safe to drink the water or not. So there's Table 6-1 in the water supply rule has several pages of all of the various standards and all the primary contaminants. So primary contaminants are health-based contaminants. Those are health-based standards. Here's a really quick snapshot of some of those numbers and some of those chemicals these are really what we're more likely to see than others. There are some other, the SOCs, synthetic organic compounds, are all the like pesticides and herbicides and things like that. We don't typically see those in Vermont of any detection above the lab's detection levels. There's IOCs, which are the naturally occurring minerals and contaminants and things like that, which are in the bedrock. That's iron and manganese and fluoride and things like that. And the VOCs we don't really see also. We don't typically see the volatile organic compounds, but we can see, sometimes we'll see benzene, xylene, or toluene. You'll see kind of in the middle of the table there. But we do really see, depending, there's pockets of the state, and we have seen arsenic. We do see nitrate. There's what's called disinfection byproducts, so HAA5 and TTHMs. Those are two groupings of different types of chemicals. And disinfection byproducts are formed when naturally occurring material in the water reacts with chlorine that is used to disinfect the water. That then creates disinfection byproducts. So this isn't things like dirt and debris and things like that can be large particles that can be filtered out. This is humic and fulvic acid. It's all quite technical, but if you've ever been walking in the woods and you've seen a stream that looks brown but looks like tea, it's not dirt and muddy, but it looks like tea and it has color in it. That color is such fine particles that it actually is not able to be easily filtered out by most surface water filtration. So if the drinking water system is using that as a source of water, and then that has that color that reacts with the chlorine, which is good and required for disinfection, but it can create these byproducts. One kind of well-known disinfection byproduct, it's a total trihalomethane, is chloroform. So like those old spy movies or whatever, when they had the rag pressed against the damsel's face and she would collapse, that would be chloroform. Certainly in much lower levels in drinking water than you'd ever see in some black and white movie. But that's an example of what can form as a reaction with chlorine. As I said, benzene, xylene, toluene, sometimes we'll see, especially if there's a gasoline spill or an underground tank. And then there's the radiological compounds, the gross alpha, combined radium and uranium. These are naturally occurring materials that are in the bedrock, but they can create health risks. Gross alpha and combined radium are health risks due to the radiological, the presence of the radionuclides in that can create a cancer risk. Uranium's health level, we have a more stringent health level in Vermont for uranium than the federal level, and our level is 20 micrograms per liter, and that's based on, it's a basically heavy metal toxicity. It's a kidney toxicity issue at that point. And we do see that there's, like I said, there's pockets of these compounds around these naturally occurring materials and naturally occurring chemicals, sorry, that we do see throughout the state. And there are water systems that treat for various compounds listed on this table. We also regulate what's called secondary contaminants. So secondary contaminants they're not health-based directly, but the presence of these things could lead to a health issue, and they certainly would lead to aesthetic complaints. So I've highlighted iron, manganese, and sulfate. These are things that you can smell, see, and taste in the water. The primary contaminants at the levels we're discussing, really you can't see or taste or smell, but the secondaries you can. So the likelihood is we will get complaints more for iron than we will for arsenic, because you can't taste arsenic in the water. But the iron will generate the complaints because you can see it. You can fill a bathtub and it looks orangish or red. And manganese can lead to purple or brown. Sulfate would smell like rotten eggs, things like that. So this is what we're likely to see complaints off of, and this may trigger some calls to the town health officers because of the presence of any of these contaminants. So the numbers listed here are not health-based numbers. These are not health-based standards. These are aesthetic standards. Above these is when you'll start to taste and smell and see and things like that. But just because it's an aesthetic standard doesn't mean it couldn't lead to a health-based standard, especially iron and manganese. They can react with chlorine, and if you need a certain amount of chlorine to disinfect the system, and you have these things that are reacting with the chlorine, you might not be providing enough chlorine to disinfect the system. So it can have that kind of indirect effect on things, which is what we do try to control. So here's a little video of how to find chemical data for public drinking water systems. You go to dec.vermont.gov/water, which will bring you to our homepage. If you scroll down on the left-hand side, you'll see a searchable databases link. You click on that link. If you scroll down to public water system sample and sampling schedules, it'll bring you to this page. And I'm in Montpelier right now, so we'll search Montpelier real quick. And then there's several different things. You can see the bacteriological data, the chemical data, lead and copper data. We'll start with bacteriological data. And since it's a keyword search, anything with Montpelier in the name popped up, click select, and this will show you all of the chemical data we have on file for the Montpelier drinking water system. It'll tell you the date it was sampled, the reason. So this is total coliform, whether coliform absent, E. coli absent, where it was sampled, and then the right side there will show you the chlorine residual. If there's a positive, it'll be in red. So this one I'm highlighting was total coliform positive, E. coli absent. I think that was in response to a leak, so that's why it was a special purpose sample. And you can see this goes back to 2004. So then you hit back, you can select chemical data and hit search. Select Montpelier again, and this will pull up all the chemical data we have. So you can see again the date sampled, the purpose, the contaminant or analyte, what the concentration was, what the units are, whether it was non-detect or not. If it's non-detect, below laboratory detection limits, there'll be a Y, so non-detect, yes, and then there won't be a value. And then this, again, this goes back even further. This goes back to 1988. So all the data we have, and this is real time. This is the data we have on file, and if it's in our database, it's right there, and that's it. So we don't have it if you can't see it there. So that's a pretty fast run through of the public drinking water program. Here's a list of some contacts. So if there's general questions, things on compliance, enforcement, jurisdictional determinations, you're not sure if something is a public water system or is served by a public water system, those can come to me. Our transient non-community water systems, again, those are the 25 or more people for 60 days or more. That's managed by Meredith Maskell. Total coliform sampling is required of all public drinking water systems. That's handled by David Love for the community and non-transient non-community water systems, and Tanya Dyson for the transient non-community water systems. If there's questions about engineering, construction, sanitary surveys, technical assistance, something like that, that can be directed to Tim Raymond or Patrick Smart. Our capacity development program is managed by Megan Young. Our source water protection program is handled by Laura Ranker, and source water permitting questions are managed by Rodney Pingree. On the bottom there's the link dec.vermont.gov/water/contacts. Will give you a list and kind of a description of everything, who we are and everything we do.